Hi, everybody. If you are just entering the room, welcome. This is the San Francisco County breakout session. If you don't live in San Francisco County, you are in the wrong place. Um, and if you do, welcome. Feel free to pop in the chat to say hello, to tell us where you're from. We're going to be recording the panelist presentation portion. We won't record the question and answer section. So please just be aware of that. No names or any personal information will be disclosed. The only other thing is, if you have questions, please pop them in the Q&A section. So on the bottom of your Zoom window, there's chat, and then there's also at the very end a panel Q&A. So you can put questions there, and after the panelists are done talking, we'll start taking questions from there. All right, thank you. All right, I think we can start in about 30 seconds. So over to you. I would like to introduce our three panelists. First, we have Dr. Ayanna Bennett, who's the director at the Office of Health Equity at San Francisco Department of Public Health. We also have Dr. Malcolm John joining us today, who is a physician at UCSF, but also the co-chair of the Health Equity Council. And then finally, we have Roux Pendleton, who is Policy Director for Community Wellness and Hope SF from the Office of Mayor London Breed. Thank you to the panelists for joining us today. We really appreciate it, and we're looking forward to all the information and clarifications you're going to give us about the COVID vaccination process.
Thank you. So should we start now? Next slide, please. First slide. So good afternoon, everyone, or good evening. My name is Malcolm John. I'm a physician at UCSF, and today I'll be doing the first half of the talk on COVID-19 vaccines, starting with the vaccine overview. Next slide. So I'll cover the vaccine yeah, there you go. So next slide, please. So as most everyone on the call probably know, we have 3 approved vaccines, 2 mRNA vaccines from Pfizer and Moderna that's been around a while, and most recently a single dose vaccine. The other 2 are 2 doses. The single dose is from Johnson & Johnson. Next slide. So all of the currently approved vaccines are highly effective at preventing hospitalizations and death. And when you really look at full efficacy beyond 1 month, essentially we haven't seen any deaths in the group associated with vaccination. That was not a primary endpoint, but it actually is a useful endpoint. And most of them greater than 90% prevention of hospitalization, so near 100% in that regard as well. And they're really equal in that regard. The vaccines were tested in clinical trials. I think when you look at it, Pfizer was more than 40,000, Moderna more than 30, and similarly J&J more than 40,000, involving tens of thousands of people. And the key thing, it was across age ranges and ethnicities. So for Pfizer, 10% African-American, about 13% Hispanic or Latinx. Similar numbers for Moderna, slightly more Latinx population, about 20%. In both studies, 4 to 6% API or Asian Pacific Islanders. When you look at the J&J study, it's a global study, those numbers are about 2-fold higher for all of those groups except for API, which it's not significantly different. They also included a significant portion of folks greater than the age of 60. I did want to emphasize that Pfizer, they included folks 16 and older, and it's the only drug approved at that age range. The other 2 are 18 and above. Of note, in the third bullet point, we have over 50 million doses. Actually, you saw Dr. Burke's data. So for California, and I think that's most noticeable. And again, as I mentioned, no deaths related to the vaccines, both from COVID-19, but also side effects. There are people who have died with some association, perhaps, of side effects that were not properly treated. Folks may talk about the group in 20 or so 80-year-olds in Norway, et cetera. But again, when you look at the globally, how the tens of millions, almost like 100 million folks vaccinated across the globe, it's less than 20 people, 40 people for whom there's these question marks and no attributable deaths. And I think that's important odds for people to keep in mind, because I know people are hearing different things on different parts of the internet. Next slide. So how do they work? Basically, the vaccine, this is a coronavirus here with the spike protein on its surface that gives it its name, the crown, when you cut it in certain sections. And that protein is essential for binding or attaching to the cells and is the target of almost all the vaccines. And we're really using the vaccines to teach ourselves to attack that protein if it recognizes it. And I'll talk a little bit more about that shortly. You cannot get COVID-19 from any of these vaccines. There is not a complete or whole vaccine, just instructions on how to create a spike protein, or future vaccines will actually have samples of the spike protein. So again, not a complete virus in any form or fashion. You cannot get COVID. It typically takes about 2 weeks after completing the vaccine series, whether it's 1 shot or 2 shots, to start to really see a difference or protection. But I always caution people to really, the protection continues to increase over time. So I usually encourage my patients to wait about a month to really think that they have hit the other side of the curve and really are fully vaccinated. With J&J, we have data that you continue to develop protection as far out as 2 months. So please, when you get vaccinated, still protect yourself. Most side effects, as noted in bullet 4, are minor. It's the sore arm people talk about, 3 to 5 days. We ask you to move that arm, take Tylenol or ibuprofen as needed. Do not take them before you take the vaccine, because there is a theoretical risk of decreasing the response. For some people, they'll have flu-like symptoms, headaches, nausea, muscle aches, maybe be wiped out a day and a half, sometimes out to 2 or 3 days. That's very uncommon. And again, we do ask people when they get the vaccine to wait about 13 minutes after the vaccination, 30 minutes if they've had a previous serious life-threatening allergic response, also known as anaphylaxis, trouble breathing, tightness in the chest, to any previous antibiotics or medications, and also if you've had responses to food. Next slide. So this slide, I am going to take a little time just because I think it's the money slide in terms of how these vaccines work. And these are the mRNA vaccines, Pfizer and Moderna. So as I mentioned, we're really attacking that spike protein on the surface of the virus. And what we are doing in these vaccines is taking a small sample of the instructions to make that spike protein called mRNA. So what is mRNA? So if you think about it, most of us understand or have heard about DNA, the code of life, the book of life, okay? Not quite yet. The book of life, the code of life, this is fine. And it's so important because it has all the instructions on how to do everything in the body, that it has to stay in the central library, the nucleus. It cannot leave. Yet you have to get instructions out to the factory workers on what to make for the day. So what do? You go old school, and people have heard me say this before, pen and paper. You copy down the instructions. So today, we're going to make a liver cell. Go to page 27 of that golden, precious book, the DNA. You open it up, you copy down the instructions on a piece of paper, take it to the factory workers and say, here they are. Here's the instructions for the day. That piece of paper with the handwritten instructions is mRNA. And like a piece of paper, you pass it around to all the workers to make liver cells, but by the end of the day, it's all tattered and torn. And that's important because the body does not want too many liver cells, so you don't want that piece of paper hanging out. This vaccine, these mRNAs, disappear in about 10 hours to 3 days out. In any case, they take that mRNA, cover it with 4 salts, 4 fats. You might hear the term lipid nanoparticle. Just means 4 fatty oils, 4 salts to protect the mRNA, because it's that flimsy sheet of paper. Put it in a syringe, give it to you in your arm. Bullet point 2, it enters your cells, these blue dots. Next. And it causes the immune system to produce antibodies and cells that recognize these proteins on the surface of the cell. Remember, your cells are going to see this mRNA, make some spike protein, put it on its surface. Those are those green dots. The body's going to say, it's like having a really nice military in your body. They walk around, they check out your home, they check out the outside and say, whoa, wait a minute. Spike protein, what is this? Not supposed to be here. Got to get ready for an attack. So the next time that it sees a virus, next slide, The next time it sees it, it's going to recognize those spike proteins, those antibodies and cells are going to attack it. So that's basically it. J&J is very similar, except it's a DNA virus. It's more stable, and that's why you don't need to freeze it. And you go from DNA to RNA, and the same process happens. Next slide. So that's J&J, just talking about it. Single dose, very effective, moderate to severe COVID disease in a multi-country study, United States, Brazil, and South Africa. So has been studied later in the pandemic in the era of variants, still very effective. No hospitalizations or deaths beyond 28 days after your dose. And as I mentioned, it's DNA. And in this case, instead of 4 oils and 4 salts, it's inside a viral particle, not an active virus, a viral particle, meaning the outside of something called adenovirus, one of the viruses that causes the common cold. They take out the center of it essentially and put in this DNA. The adenovirus binds to your cells, sends the DNA into the nucleus, that treasured library. And once again, the workers come in, make a copy of mRNA on a flimsy sheet of paper and tell the cells, make some spike proteins. Next slide. So vaccinations is a critical tool to slow the spread of the pandemic. You still should socially distance. In most cases, we'll talk about some exceptions. You still should wear a mask. You still should wash your hands, etc. We believe that most everybody, including students, will have access to the vaccines by the summer or fall. They're studying vaccines now in kids under 16. But at this point, it is not yet approved for that. They should all be free. You should not be asked about your immigration status. And while it's highly effective in protecting from symptoms, it is not 100% effective. So even after being vaccinated, you need to do the social distancing, et cetera, as I mentioned. Next slide. A little redundant. What can you do after getting vaccination? And this is the thing that made a lot of people happy and thought it was a little bit overdue, but we're learning every day about how much we can do. How long will protection last? Will you still shed from your nose? I will say that the data suggests that it decreases asymptomatic, meaning no symptom, shedding from the nose by at least 70, if not more percentage. So with this information, the CDC now says fully vaccinated people, as you can see in the first section, you can visit other folks who are fully vaccinated indoors without wearing a mask or socially distancing. You can also visit unvaccinated people from a single household who are at low risk for severe disease, and you can do that without wearing a mask or physical distancing. If they have immunosuppression, chronic kidney disease, or any other risk factors, then you need to wear your mask. You don't need to quarantine if you are exposed, because now you're fully vaccinated. But for now, we need to take precaution in the public, as mentioned at the bottom, wear your mask, socially distance, etc., and avoid medium to large size gatherings. Next slide. And I'll pass this on to Dr. Ayanna Bennett.
Hi, everyone. So I am going to quickly tell you about how to get your vaccine. There'll be numbers at the bottom, at the back of this presentation. I'll go quickly through it. Go to the website, do the numbers, and get what you need. You can always get this information again. Next slide. So we are getting our instructions from the state. The state is getting some of its instructions from the federal government. So your local folks don't have complete control over how to allocate, but we are getting free vaccine every day. Go forward. So we're working very hard to be equitable, to focus on the communities who are the hardest hit. That's Black, Latinx, Pacific Islanders. And we're prioritizing going fast. We want to get everybody vaccinated if we can before variants come or anything changes. Keep going forward. You can get vaccinated based on this schedule. Here's some information about where to go and who to call. The last slide will leave up a little bit, and that has the same information. You can write it down. Go forward. The prioritization plan is a little bit complicated, but healthcare workers, teachers, childcare, they've all been allowed for a while. Just in the last couple of weeks, week or and a half, people with health conditions have been on the list. So now you should start to see your neighbors, your family members who are disabled, who have cancer, who have sickle cell or a heart condition. They should start to be on the list. Homeless people and people living in congregate settings are just at risk because they're all squished together. They're also on the list, so correctional facilities. So it depends on where you live and what your health is like. Keep going. The expectation is that by the end of April, it'll be everybody. If you're eligible, you can get it at your doctor's office. If you have one, if you don't have a doctor, you can go to the county to get it. We have pop-up sites. You can look on the website to tell where it is, or just call the number and they can help you. We're trying to get up to 10,000 vaccines a day. They don't give us that many, but we're going to work on it. We have community access sites, mobile. We're doing lots of things. Keep going forward. If you can't get it at any of those sites, what's not in here is CVS, that there's a lot of pharmacy vaccination happening now. You should go to their websites individually if you want to try that option. I recommend everybody try every option if you can, or get your child to, or your friend, or your whoever you can. So one more slide. That is what the website looks like, but these are the different sites you should go to. Go to the vaccinated, go to the Get Vaccinated site. myturn.ca.gov tries to do it statewide. The phone numbers, the first phone number is for anybody who is trying to get a vaccine because they're eligible. If you're over 65 or have a disability, they have another number that's trying to make sure that those people get a little bit of extra support, extra preference. So please do call that other number if you're in that group. And they are, the county is trying to supplement what the private providers are doing. Please do use your private provider if you have one. 70% of the vaccine that comes into the city goes to either UCSF, Sutter, CPMC, or Kaiser. We're not holding all of it. They have quite a lot of it, and we need people to get it from them and everybody to really focus on those most in need, which is the people on this call. So I'm hoping everybody is actively waiting for your turn or actively trying to get your vaccine. If you're not, hopefully we've given you enough information to really, really think about it. I'm sure there are a lot of questions, so I'm going to turn it back over.
Yeah, we'll do questions in a bit. I just want to leave room for Roux to say a few words before we start questions.
Great, and I'll be brief. So good evening, everyone. My name is Roux Pendleton, and I serve as the Policy Director for Community Wellness for Hope SF in the Mayor's Office. And so Hope SF is a housing initiative to transform San Francisco's most disinvested neighborhoods into thriving, inclusive, mixed-income communities without displacing original residents. And so Hope SF is framed as an initiative that advances racial equity and reparations in San Francisco. And so we are comprised of 4 housing communities: Alice Griffith, Hunters View, Potrero Hill, and Sunnydale, that are in San Francisco's Southeast sector, District 10. And so there are about 5,000 residents and over 2,000 families that live in our Hope SF communities, with about 45% of those folks being Black folks. And so when COVID hit, we knew our communities would be impacted. And what I want to continuously uplift are the ways in which community-driven approaches are what held and continue to hold the residents in Hope SF. So at the first town hall back in July, I talked about and uplifted that how in the midst of a surge in cases in Sunnydale, an annual Family Day event was really used and served to take care of community needs in a way that was culturally responsive and rooted in culture. So Drew Jenkins brought COVID testing into community, like on site. And so that significantly increased the number of Black folk that were getting tested. They also did food distribution and provided like culturally relevant PPE. So really this full wraparound model of support to community to increase access to testing. So our learnings from that showed us that with vaccinations, the same thing needed to happen. So we've been in partnership with a close trusted partner, Simone Ippoliti, who works for the Bayview Child Health Center. And she's the site director there. And she's been providing vaccinations and or testing at 3 of the 4 of our housing sites since like May of last year. And as soon as we were able to get vaccine supplies, she's been doing that as well. And so this has not been a perfect rollout, though. We still have a gap in our Potrero Hill community. But even with that gap, a community resident, Uzuri Peace Green, reached out to Dr. Kim Rhodes of Umoja Health. And even last Saturday, provided 110 vaccines to folk to come out. So we know there's a lot of work that we need to do, but our ultimate goal and how we're approaching this is that it's very community centered and driven, and folks are working with close partners in community that are there every day. And some of them happen to also be residents. And so ultimately, we're really just trying to provide low barrier and culturally responsive access to vaccinations for our residents. So thank you. That's it for me.
All right, thank you so much to all three of you. I'd love to invite you to turn your cameras back on because I'm not quite sure if all three of you will address the questions. I think maybe if you just tag team it, that would be the best approach. So we have, I'm seeing a pattern here. We have questions around the vaccine and its efficacy for sort of special groups. So maybe we can take those first. There was a question around whether pregnant participants had been included in specifically the Johnson & Johnson human trials. And then I want to just like tag on to that, a question around whether or not the trials had actually included folks with autoimmune diseases or any